this view is going to be our template, our guide, but we want to focus on this view over here. So, now we have to be careful. Why do we have to be careful? Because notice how the line here, the fuchsia color that you're seeing, is not at the level of the disk space. Okay? It's not. It's at the level of the bone. Okay? So we're going to go back up to the disk space. And what we're now going to see is the lack of room available for my pointer. Can you see that? Can you see how we've lost that nice concavity or kidney bean shape over here? Okay. Can you see how these joints, the facet joints, are larger? And if you want, I could take this off of magnification to make the point more evident to you.
No, I can see that.
Yeah.
If you'd like, I can do that. But the point is, you have this overgrowth or arthritis within the joint of the facet, and that's going forward, okay? You have the disc that's pressing backwards, and that culminates in neuroforaminal narrowing, okay? Remember?
Yep.
Right? So it's multifactorial. It's not just one thing that we have that's causing the stenosis. So then I get to this black structure right here. Can you see that in a triangle? That's the ligamentum flavum that I talked about, yellow ligament. That's the ligament that tends to grow as we age, or with a lot of steroid injections. Not 3 or 4, but 15 or 20, for example. And so this ligament tends to grow. Now, if this ligament tends to grow significantly, now we have compression of the spinal canal, okay, from this ligament.
Oh.
We have compression of the spinal canal from the overgrown facet joint over here, and compression from the disc herniation. Make sense so far?
Pretty much so.
Okay.
I'm trying.
Yeah.
Take a look at the ligament back here. Again, we're not at the level of the disc, but the ligament still is there. Okay. Now we're going to go down to L2-3. And notice, very importantly, when we're not at the level of the disc, look how nice and wide the spinal canal becomes, right? So the problem isn't the bone. The problem is the disc. So let's go down to now L2-3. Okay, so this is L2-3, all right? What are we seeing here? Well, first thing that jumps out is the real narrowing that you have of this spinal canal, okay? Remember we had that nice, big, almost diamond-like picture up here? Let me go back to show you on our control level. Remember this?
Yep.
We use this as our control. And now we're going to go down to L2-3. Where did that space go? Well, the space is left because we have a disc herniation over here, right? We've lost that nice kidney bean shape. We've got overgrowth of the joint, the facet joint, arthritis, and the other thing is look how big this black structure is, that ligament, okay? Now, on the left side over here, there's a little room for the nerve, but not much. I would call that moderate foraminal narrowing. On the right side, it's very significant, okay? It's very significant. That's L2-3. We're going to go to L3-4. And I want to go to this level. Now you're going to say, well, Doc, I thought you said we had to be at the disc level. Well, there's a reason that I'm showing you this picture right here. This right here, this small black structure is a disc herniation. That disc herniation has actually migrated upwards, and that right there is the disc herniation. Okay? So that disc herniation has left the disc and it's migrated north. Okay? So that's also causing narrowing of not only the spinal canal, but also what's called the lateral recess, or the area where the nerve exits here. Okay? The area where the nerve exits. This is on the right side, which is very narrowed. It's also narrowed on the left side. Okay? But this disc herniation is called a paracentral, which means it's not straight back, it's favoring the right side instead of the left. But the narrowing is apparent on both. Now, when we go through one more click, we should be in the disc space, and now we're seeing the narrowing that's actually equal on both sides. We're seeing that. We're seeing a significant loss of that normal fluid that we had up top here. Okay? We're seeing the facet arthritis and the growth of the ligament once again. It's going to be redundant because the problem is not very different as we're marching down the spine from L2 down to here. But we're going to go ahead and go through each of these levels. And if you have any questions, you don't understand what I'm saying, I want you to stop me and I want to review it with you. Okay? Okay, so this is the beginning of the disc right here. This is really the bottom of the L4 bone. But already what are we seeing? We're seeing a disc fragment over here, okay? A disc fragment right there. We're seeing a narrowing of the spinal canal over here. And we're also seeing the arthritis of the joint, okay, on both sides. We're going to go down one more, and we're seeing it even more. Now on this side, the left foramen, where it exits, is almost completely obliterated. Okay? There's almost no room for that anymore. We still have that growth of the ligament in the back, and we have that herniated disc in addition to the arthritis over here. Make sense so far?
Sure. Sure.
If it doesn't, stop me, and I do want to make sure that you leave here understanding this, because if you don't, then I didn't do my job today. All right? So, we're going to then march down to the final one, which is L5S1. Now, at L5S1, you have a herniated disc. These dots right here, which are hard to see, are the actual nerves at L5S1. They're difficult to see. We can try to magnify this at this level.
Can you see them? I can see them. Mom can see them.
Yeah, the little owl eyes.
Yeah.
Okay, and basically the disc herniation is kissing on both sides those nerves. Okay, the spinal canal actually is getting smaller down here. Okay, so I wouldn't say that you have severe stenosis centrally over here, but I would say that you've got moderate stenosis or narrowing by where this nerve is exiting and trying to go down your leg. Okay? Does that make sense?
Mm-hmm. Yeah, on the left leg.
Down both.
Down both.
Both sides are narrowed here. It's very clear. Both sides
No
have narrowing.
different.
Why is she not getting more of a problem in her right leg then?
Keep in mind, the symptoms have gone from one side to another, and very rarely do we see, when we look at the MRI, just one side being affected unless it's an acute problem. Therefore, we don't make surgical recommendations based on pictures. We make them based on clinical exam and the patient's symptoms. Okay? Because if we did it based on pictures, then we could say the entire lumbar spine needs to be operated on, and this X, Y, and Z is what needs to be done. Okay? So we use this as an instrument, but we don't make all of our judgments on treatment based on pictures. Okay?
Okay.
Because if we did, then we would be doing a lot of surgery on the right, a lot of surgery on the left, we'd be doing a lot of rods and screws, but that's not your problem.
Mm-hmm.
Okay? So we have to keep it in context. Typically, patients with spinal stenosis, where it becomes severe enough, as we march through the images again, will find that it varies from leg to leg. It goes from one side to the other. Okay? And the span of time between one and the other varies. The pain could also be on that other side right now, but may not be as severe as the left, and therefore you're not noticing it. Okay, we're just marching up again just so you can take another look at the MRI and the narrowing throughout. Okay, and what's kind of neat here from an intellectual approach